All right. Hi, everybody. Thanks for joining us today for our panel discussion on mental health after spinal cord injury. My name is Tori Bowman. I work for Spinal Cord Injury Ontario, and I'm going to moderate the overall discussion today. So go ahead, Christine. My colleague Christine Sellinger, that's who I was just referring to, Christine is moderating the online discussion and she'll be advancing the slides. So panelists, you can give Christine a look or a nod when you're ready for things to move along. So before we begin, a couple of basically technical details. So we have a small audience in person. We also have an audience online today, which means there's a few things for everyone to keep in mind. We are going to have 2 pauses for questions halfway through and then again at the end. And we invite folks online, you can type your questions in the chat window and Christine will relay them to the panelists. And folks that are in person, you're welcome to come on in. You're welcome to ask questions. I will come around with my mic, and or if I miss you, then I just ask the panelists to repeat the question into the mic before we respond. As you're asking questions, do keep in mind we are recording this. We'll be uploading it to our website afterwards. So don't share personal health information. And try to frame your question broadly enough that it will be of wide appeal to all the folks that are listening in. Please put your cell phones on silent. It's a panel format, so the way we've structured the discussion today, we've identified the first and second person who's going to speak, and otherwise the panelists are going to go back and forth between slides and improvising and bouncing off on each other's contributions. So feel free when you're asking a question to address it directly to one panelist or just address it to the panel altogether. All right, so when we were trying to decide what to do today, the topic can be fairly broad. We did a needs assessment with our peer support volunteers across the province, and we said, okay, mental health after spinal cord injury, what should we focus on? And these were the 4 topics that were most highly rated. The first, understanding the brain and emotions. 2 is what to expect and challenges during recovery. The 3rd is supporting a loved one experiencing a mental health crisis, and the 4th is giving yourself a mental health checkup. So the way it's going to work, Brandon and Nancy will share a story to kick off to kick off each section, and then the rest of the panelists will jump in and contribute their perspectives. Okay, so over to the panelists. I'd like you to introduce yourselves, please. Maybe starting with Nancy?
Hi everyone, it's such a pleasure to be here. My name is Nancy and I'm part of the Knowledge Enterprise team and working at the Resource Center. I had my spinal cord injury about 13 years ago at the level of T12 L1 and 2. It was incomplete injury. In my case, my injury was the result of a suicide attempt. I was very depressed at the time, wasn't medicated, wasn't treated, had very limited knowledge about mental illness and mental health, and basically I think if I knew then what I know now about mental illness, this injury could have been prevented. So therefore I'm really excited to be here to share my insight and my personal experience and hoping to help prevent injuries from happening due to suicide. So thank you for having me.
Hello, my name is Brandon Ong. I'm a peer support volunteer at Spinal Cord Injury Ontario. My accident happened in 2011 of a wipeout on black ice, and from that occurrence I had neuropathy challenges within that year, and in 2013 I had surgery done, a lumenectomy, cervical vertebrae C4 to C7 surgery done in that matter, and then I got admitted here at SCI Ontario.
Hi there, my name is Chantel. I am a Regional Services Coordinator with Spinal Cord Injury Ontario. My background is social work, and I do have a personal investment and interest in this issue. My father sustained a spinal cord injury in 1986, so a long time ago, and so that's my invested interest in this topic.
Hello, I'm Dr. Martha McKay. I am a psychologist at Lyndhurst in the Brain and Spinal Cord Injury Program. I have clinical practice in clinical psychology and clinical neuropsychology, and I also am a fellow at another institute where I study stress and depression.
Hi, my name is Bridget Dagus. I am a social worker, and I also am a professional practice leader for Lyndhurst. I work at the Rumsey Neuro Outpatient Program for individuals who have an acquired brain injury, as well as I also work at the Lyndhurst Center Inpatient.
Thank you. So I'm here to share my story and my journey. When I was a baby, I was one of those infants that cried all the time. It was really hard to put me to sleep. When I was a kid, I was very neurotic and phobic. And at the time, I didn't know there was anything wrong with me. I thought that was just the way that everybody was like. Until when I turned 18, I started to have symptoms of clinical depression. The very first symptoms was insomnia. I felt like the pace of my thoughts was very fast. I could not stop thinking, and I just could not sleep at night. And even taking 5 sleeping pills, and that wasn't even possible to get a nap. And also there was also a lot of physical symptoms associated with my depression. And not sleeping for about 2 weeks or so, I just started to have suicidal ideas. At the time, I just really wanted to die, but I wasn't thinking about how to actually do it. But 4 weeks without sleep, it was much more intensified. Every car that drove towards me, I had a strong impulse of jumping in front of it. Every time using the subway system, I would just fantasize about jumping up the track. So literally 24/7, there was nothing else in my mind besides the need to die. And at the time, again, I had no knowledge about depression or mental illness. I didn't think that it was a medical condition, so I didn't really seek for treatment. And then also, based on, at the time, 13 years ago, there was really any awareness campaign out there. And even when the times when I reached out for help, people were not very understandable. They were just very judgmental. And so for various reasons and a lot of factors, I just couldn't live like that anymore. Not sleeping for 2 months, it would drive anybody crazy. So I tried to hurt myself by jumping off the balcony from the 8th floor. And fortunately, I landed on a very small pile of soil, and I survived miraculously. But however, that's how I sustained my spinal cord injury. And when I got to the hospital, I saw my psychiatrist for the first time, and he was my doctor for the next 10 years. And he began to medicate me. And about maybe 2 weeks being on those medications, I started to feel drowsy and sleepy for the first time in 2 months, and several weeks more being on those medications, I was able to sleep maybe at least 4 or 5 hours a day. And as the pattern of my sleep was restored, I felt like all the physical symptoms was dramatically better. And by the time I was out of Lyndhurst, which was about maybe 6 months after my injury, and I just realized that it was a preventable injury. Had I been treated in time, had I been medicated in time, I would never have jumped. So for the following 4 years of my life, I was living in this huge regret that I never thought I would ever get over with. I didn't think I would ever be happy again, and life was just really, really difficult. And fortunately, I have a strong support system, so without them, I don't think I would ever make it this far. And 2007 was the time that they actually formally diagnosed me. So it was bipolar disorder that I had all along. I later on find that for people with bipolar disorder, we have probably have 20% more neurons in our brain compared to an average person, which explains why I always had a lot of mental energy ever since I was a baby, and that was basically what triggered the depression, which was almost inevitable in my case. And fortunately, with the right type of medication in 2007, I started to recover. And I remember there was just one day, which was about maybe a month being on those medications, I woke up one day and feeling completely different. I was just happier. I was just refreshed for no particular reason, and I was just really confused. In the beginning, I didn't know why, but I was just experiencing my inner state in a very different way. And as I took my medication more and more, and I was able to totally recovered, and my sleep, the quality of my sleep became better, and the quality of my thoughts were better, and I never looked back since. So in my case, my mental illness has a very strong genetic nature. My grandma, my mom's mom, she has been suffering with anxiety disorder, so it kind of runs in the family. Again, I think it's a medical condition, and the medication was the key to my recovery, was the key to my treatment in my perspective. I'm sharing this because I think there's a lot of misconceptions about depression. People think that you really need a huge reason to commit suicide, but in my case, I really did not have a good reason to end my life. It's only because I was sick. My brain was sick. All the chemical makeups and biochemical components were unbalanced, and therefore medication was the key to my recovery. So here's my story, and I hope people can probably relate to it and maybe find some helpful insights from it. So I'm going to pass it on to Martha.
Thank you, Nancy. Thank you for sharing your story. I think it's brave and it's very helpful, and it highlights a lot of issues surrounding some misconceptions about mood disorders and all the things that you talked about. Very helpful. So I'm going to start a little bit talking about the brain in general, and talking about what so as you know, the brain controls everything we do, right? We all know that. We're all aware of that. Including emotions and including how we feel. And so, as Nancy has pointed out, you know, more recently there's been discussion about how things like depression and bipolar illness are related to the brain, and there's a ton of research out there. I included in the slide the limbic system. The limbic system is a network of structures that we think are involved with emotional perception of emotions, and as well as emotional regulation, so affect regulation. And those are certainly impacted by disorders like depression and bipolar, along with things that Nancy talked about, the biochemical, so neurotransmitters. So there's a bunch of, evidence to suggest that neurotransmitters are heavily involved in these disorders, and in fact that's what a lot of the treatments, particularly medication, would target. I'm going to slip. So following spinal cord injury, whether or not it is something that was pre-existing, we know that affect regulation can be impacted by that. So as in Nancy's case, there was a pre-existing disorder that was contributing to that. In other people's cases, if it was a traumatic event, they could also experience a brain injury on top of that. In either case, emotional change is expected after spinal cord injury. And it is related to the brain activity and things that we've talked about. So some things that you might see are things like depression, hopelessness, the inability, so that affect regulation, the inability to control, so people might find them more emotional than they were before, more tearful or laughing more easily. It's unusual for them. Increase in anxiety. If it was a traumatic situation, we expect to see post-traumatic type symptoms. There's shame and grief, irritability and anger that can be seen post spinal cord injury. either due to a pre-existing mood disorder as Nancy described, or due to traumatic experience with sustaining the spinal cord injury. Okay, why I showed the limbic system before is just in general, we think that that's involved, as I said, with perception of emotion, emotional regulation, and certainly involved in a lot of mood disorders, implicated in the pathophysiology of many of those types of disorders. It also has links to the frontal lobes. And we know that frontal lobes are involved in a number of higher level thinking abilities that are often impacted by a major life event or a major stressful event, traumatic brain injury, and other illnesses such as mood disorders and bipolar disorder. So frontal lobes are involved in things like planning, organizing, carrying out plans, attention and memory, reasoning, and what we call mental flexibility, so being able to switch and adapt to new information very quickly, problem solving and organization of information, as well as planning and judgment. And so a lot of these things can have repercussions, particularly post spinal cord injury, where there's a lot of things going on and you have to make a lot of decisions. When these things are impacted, it can be a further challenge for individuals. The other thing I wanted to talk about is the association with stress. And stress certainly impacts our brain, and it certainly impacts our well-being, our emotional well-being, and it certainly can impact those higher level thinking abilities that I just spoke of. And so sustaining a spinal cord injury is an extremely stressful life event, as it impacts every area of your life, and some of the things on the slide are just a tip of the iceberg. And so there's a lot of unknown, and there's a lot of stress that comes with it, and it's not the regular everyday kind of stress. It is major life stressors, and we do know that there are links between stress and drop in mood, and stress and depression and mood disorders. So it's an important link to make and to recognize, and to manage stress while recovering from spinal cord injury. And we do that, as I said, stress is a part of it. So there is a normal level of stress and sadness and anger that people will go through, of course. I say often to people, nobody goes through this without tears. Nobody goes through this without a very bad day. So those are to be expected in the adjustment process that people go through. Okay? Brandon. Okay, sorry.
Thank you. Thank you very much. That was great. Nancy sharing her experiences, and Martha also sharing about how the brain works. I'm going to share my experience in terms of what to expect and challenges during recovery. In terms of what to expect during I'm talking about obviously in terms of in this situation, I'm just talking about my case. The expectations was uncertain because, when you get into an accident in any kind of way and then have to go through surgery and then go through a whole process of recovery and rehabilitation, there is no definite answer in terms of what is the correct way to get things solved within yourself. So there's a lot of unknown questions that are constantly going on with your head, and that does involve, you do get depressed, or also you get mood disorders of questioning, whys or hows or who, or in a lot of cases, all these questions that just come into you at once. So from that uncertain period of time, then you have to go through another like a transition period of time of how am I going to now deal with this? When I came to SCI, I think 3 days I just stayed in bed because I just didn't want to I didn't want to see anybody. I didn't want to see the food. I didn't want to smell the food. I just lied in bed there and just tried to build myself up. But then from there on, I had to learn to start from the beginning again, learning how to you know, dress myself back up, try to groom myself, try to go to the bathroom, and all that kind of stuff. That's a lot of new challenges and experiences that someone has to go through in a period of time. But one things that got me through eventually was new opportunities that I've done in the past. So activities. I utilized the opportunity to play pool again, and that gave me hope of building myself back. Playing table tennis is something that got me back on and giving my abilities in staying active. Playing back music that I used to be able to enjoy playing. I had to adapt within my mobility when I was trying to build myself back up. Lifting up a guitar was a challenge. So I learned to play the mandolin and the ukulele. There are certain things of acceptance that I had to do, and that involved with my fingers, that I can't pick a guitar anymore. That was hard for me to accept, because I wanted to learn how to play flamenco guitar and music, and that's involves a lot of picking in it. However, I had to learn to accept and change my ways of doing things, and that comes a long way. One thing though that I want to address, that's I think is a very important thing, that within my condition I am an incomplete I guess survivor within my condition, is invisible disability. I'll just read to you a bit what an invisibility in certain contexts means. Is an invisibility is a disability that is not immediately noticeable. They can include brain injuries, chronic pain, mental illness, and much more. Because they are not obvious to spot, invisible disabilities may be overlooked and misunderstood. And unfortunately, this can lead to discrimination or exclusion of those with an a visible disability. So just a quick situation that I had to deal with in society after when I got out was I was at a bar, and I was about to leave the bar, but for some reason, I don't know, this guy was just, he got some drinks at the bar, and he just nudged me on the shoulder, and you know, I turned around and I was asking, you know, what's wrong? Is there something wrong with it? All of a sudden, he just he shoved me on the ground. He pushed me and he shoved me on the ground, and I fell, and then I was with my cane during that time. So when I fell, nobody in the bar helped me get back up. I had to find my cane, and when I found my cane, and then another guy came up on me, and then he said, "Don't do it." And then all of a sudden he took my cane and he threw my cane away. And you know, so in terms of mental distress and stuff like that, obviously I had to go through a situation in a matter of saying, well, what happened there? You know, I'm not saying everybody's they're all bad people out there. There's good people also and stuff like that. But unfortunately, there's circumstances of people that are out there that that did those unfortunate things that I had to deal with. So yeah, so that's the situation I had to deal with in terms of the challenges of recovery. And just another one quick thing that I also had to deal with. I'm a single father, and I have a daughter. And when I was in the subway, she was with me, and there was a lady sitting down on the seat, and she maybe she wasn't aware that my daughter was with me, so she saw another lady, and so she offered her seat to the lady and to my daughter. But when I said that she was with me, then she turned her head, and then she just sat down. These are another questions that I ask in terms of how to deal with it in society, how emotionally I deal with, and how people out there are not understanding of it. So these are challenges that I just wanted to share with everybody, and I'll pass it on to the next panelists here that can share their thoughts on it. Thank you.
It's me again. Thank you, Brendan, as well, for sharing your story. It's brave and helpful, and I think you've highlighted a lot of the things on the next slide about there's so many unanswered questions about, how your future and how to live and to function post injury. And you also provided two unfortunate stories, and I'm sorry that those happened to you, of that people lack understanding and lack consideration for those like yourself and in those situations. And that is a huge challenge, and that's something I hear about all the time, is that the lack of understanding from other people, inconsiderate, downright rude. and that's another challenge that you have to face, and I hear that quite often. The other thing I wanted to talk about was the potential effects when, I said before that there are a lot of difficulties and challenges that people face, and that can impact mood and how you're feeling. The impact of that, it's an important issue because it can have impact on outcome in rehab. It can have an impact on we know that it can lead to greater functional disability. Individuals who aren't feeling that great or are experiencing low mood, they're less likely to participate in social and recreational activities. It can impact work. It can impact relationships with others, significant others as well. Poorer quality of life, and can lead to greater caregiver burden as well. So it's an important issue, and I'm glad we're talking about it today.
Thank you. So my name is Bridget, again, and thank you for inviting me, and thank you for the stories, Brandon. And in fact, when we look at the stages of emotional recovery, I think, Brandon, as you talked about your day in the hospital and in the bed and the thoughts that were going through your mind, in fact, I think you clearly were showing these stages of emotional recovery, the confusion, and the, what's going on, the sense of depression, testing the limits, focusing on the strengths that you had prior to the onset of your injury. And what I want to say to that is, I think that that's absolutely brilliant, because oftentimes when my experience has been, when I work with individuals who have sustained certain injuries, they lose their sense of who they are. And you clearly, when you were talking about testing limits, we're looking at, what are the things I used to do? Who was I before? And what are the things that I can still maintain? And I think that was wonderful. And then, of course, there's the issue of acceptance. And you were moving towards that, learning these were my passions, music, and what can I do today? And the other key thing that I think is really important to highlight is that these stages don't happen in a linear fashion. So for a while you're in hospital, you may go through those phases. And then suddenly you're in the community and you're on the subway, and suddenly you're back at anger again. And suddenly you're back at, confusion. I can't believe this is happening. And then you're back to acceptance. Or something else might happen that might be really positive. And again, you're back at acceptance. So I think these stages are key. They happen, but they don't necessarily happen in a straight line. So I just wanted to say that.
Can I add something?
Absolutely, you can add something.
I just wanted to add that it also, not every individual goes through the same, and that it seems, or at the same rate. And so that also can be challenging, for caregivers and for other people supporting those individuals to recognize where the person is at that point in time is a key factor as well.
So certainly, and I think that's a really important point, that people do move through stages at a different time. And certainly there are a lot of activities that can assist individuals in that recovery. What's not there is music, instruments, art, which is important to add. But certainly we know a lot that relaxation exercises, and so certainly engaging in exercises such as yoga, meditation, mindfulness, and now I want to add to that slide music, art, learning an instrument. Those are all great ways of dealing and coping with emotional well-being, or whatever passions you had prior to your injury. You may not be able to do it exactly the same way, but there may be aspects of that activity that you can continue to engage in. So those are some ideas. Again, physical exercise, diet, exercises that also stimulate your brain. There's some activities there. We know diet is an important aspect in terms of mental well-being and health, and how we eat, and maintaining a sort of a balanced diet. I'm not going to speak a lot. I'm not a dietitian, but I do when it comes to depression and so on. It can be helpful. Some other strategies include avoiding fatigue. So, again, looking at your strategies for sleep. We all sometimes get into these bad habits of getting into bed, turning on our laptop, watching TV. So what are some of our sleep routines that maybe are impacting our quality of sleep? Doing some things that are more demanding earlier in the day, where you have a lot more energy. I think a lot of times we're all sort of guilty of this. Try not to overschedule yourself. Doing too much in a day can certainly increase your stress, fatigue, not feeling a sense that I've accomplished things, and that becomes a bit of a spiral, and avoid the overstimulation. Okay, so those are all sort of some strategies for emotional health. I don't know if anyone wants to add to that, or... and I think now I'm passing it on to...
Thank you. Thanks, Bridget.
Thank you.
All right. So I'm going to talk a little bit about the community integration piece after discharge, and some of the resources and barriers that are involved. So some of the resources: accessible housing, obviously, finances, personal support, employment services, transportation, Wheel-Trans, things like that. Equipment after discharge, very important. You might need a hospital bed, you might need a commode, and recreational activities like Brandon was talking about, with getting into table tennis, getting into pool. Some of the barriers that I see with my clients, definitely limited funding sources. That's a pretty huge one. Long wait times, and then even sometimes not qualifying for disability programs or support programs because of age, because of disability, or because of the finances that you have. Knowledge of what's available, so you really, you only know what you know. And the big one that we see for us we have different regional service coordinators in different regions is the disparity between geographic locations. So oftentimes in big cities there might be more resources available than in rural areas. So this is all to say that when your basic needs are not met, it's very difficult to experience emotional well-being, and you will probably feel stress, isolation, anxiety, depression, all those sorts of things. And I'll just draw your attention to the first tier here we've got of the Maslow's hierarchy of needs. So with this diagram, we've got water, sleep, food, breathing, security. These are all the basic needs that I just spoke about in the last slide, with the housing, with shelter, with getting your personal care needs met. So it's very difficult to experience emotional well-being when you're stuck on those two tiers. And I know Martha will go into this a little bit more, but even seeking counseling or therapy, that's kind of up at the yellow, but it's very difficult to start moving through that process when those basic needs are not met. I don't know if you want to go a little bit more on that, Martha.
So I'm thrilled that Chantel included this in the slides. I never thought I would talk about Maslow's hierarchy of needs as much as I do here at Lyndhurst. I think it's an important point. If your basic needs, that's in question, as I said before, these are huge stressors. And of course they're going to come with anxiety. Of course they're going to come with, a decrease in your mood and all that sort of stuff. How could it not? So what I wanted to add to that was that, this might be helpful in terms of what type of intervention or what you can do. So if you're at the bottom tiers and you're not sure, where you're going to live and how you're going to support yourself, those are huge stressors. So instead of intervening more at a higher up level, we'd probably talk about stress management. So how can you get through this and manage your stress through this enormously stressful time? Whereas once those basic needs have been established and you have an idea where you're going to live and support yourself, hopefully, then we look at higher up on the hierarchy, and that might be a different type of intervention. So maybe looking at mood management, anxiety management, or looking at other interpersonal issues or things like that. So I just I'm super glad that you put that in. And it really does speak to where we would intervene and how. So thank you, Martha. All right.
So succeeding in the community after an SCI. So definitely reaching out for help. So connecting with family, friends, finding your allies, and looking for healthcare providers for support. So I listed some below there. Psychiatry, psychology, social workers, occupational therapists, regional service coordinators, peer support. But essentially, what we also discussed is that eventually these people in the healthcare profession that might start to dwindle once you're discharged. And this is where the self-advocacy comes in. So you can, developing self-advocacy skills is very important after discharge. So understanding your needs and speaking up for what you need and understanding that it's your right for these needs and really understanding what you need. Self-management and organizational skills. I have a lot of clients after discharge that feel very overwhelmed because they have so many different appointments and how can they keep them straight and getting the Wheel-Trans. So finding really being you being in the driver's seat and organizing yourself as best you can. Actually, do you want to say, Bridget, something? Yeah.
When we were just looking at this particular slide, I was just commenting to Chantel just the importance of being able to identify your strengths, your area of need, and as this slide says, really advocating for yourself in all aspects, whether it's for medical reasons, for finances, and learning to say, this is who I am. And again, it goes back to not only talking about the issues related to your injury, but who are you and what are your needs as an individual? So I think this is such an important skill to have following a stay of inpatient, learning, understanding, and also, just sort of coming to terms with, again, what are your strengths, what are your area of need, and advocating for those things. I think it's such an important skill to have when you leave Lyndhurst. That's it.
Yeah. Oops.
Sorry.
And just the last point there, getting involved in your community. So a lot of our clients, sometimes they're home, they're feeling isolated. So getting more involved in the community in any way. So whether it's volunteer opportunities, if it's employment, if it's support group, recreational activities, I really think even just getting out of the house can improve your mental well-being. So those are all, different strategies to use of how to succeed in the community after an SCI. Anyone else want to add anything? Okay.
So I feel like at the time I was really depressed. I didn't even have the energy to get out of the bed. And CPA would send me a lot of notice of upcoming events and flyers. And I didn't really feel like going. But I kind of forced myself to go anyway. And then at the end of the day, when I saw other people with disabilities in our community, I remember seeing a couple people in a power chair, and they managed to be really happy and talking about the places they have been to, their vacations, and I just felt really good after the event. I felt like it was really worth going, and it really encouraged me a lot. So I encourage people to maybe sign up for Spinal Cord Injury Ontario's email list and check out our community events, because I do think it really helped me personally in feeling better about myself and also about the future. Just seeing some of the people doing really well in life, it gave me hope that this might be possible for me as well. So thank you.
Okay, I'll do a question. One of the things that that was on the list of potential topics for the panel was how to bring it up. So, and you could look at that from a lot of different ways. Brandon, one of the examples that you had on the subway, the lady doesn't give you the seat. How do you say, you know what, actually, I need the seat? Or how do you bring up to your family if you're getting from them, you're going to be fine, everything's fine, don't worry about it, whatever it is, and you feel like they're really not getting it, they don't understand how you're feeling and what you need, how do you bring it up? So I'd be interested in anybody's perspective on that.
So I felt like over the years I have heard maybe all the inspirational quotes that mankind could offer. Everybody was trying to talk me out of my depression and just say things that's kind of maybe very empty. I mean, it's positive. I mean, potentially it's helpful, but it wasn't helping at the time. It was just, I just couldn't snap out of it. And in my experience, I found after being on the right meds and being happy was almost effortless. I don't need anybody to counsel me. I felt like I was just happy because I'm physically and mentally healthy. So I'm not saying everybody should be medicated, but I think at least people should be open-minded about maybe trying on medications, at least on a temporary basis. And I think it could potentially benefit people. And also, I think a lot of people try to talk people out of their depression, and it's very important to really understand the nature of their condition, whether or not it's due to circumstances or whether or not it's something that's inside their body. So really have to maybe seek for professional help to identify that.
Okay, so I was just going to, Nancy, if it's okay, I'm just going to speak to the depression piece. I work with depression as well outside of a spinal cord injury population, and that's a very, very common thing. And hopefully there is more information out there, as you spoke to before. There wasn't when you were going through that initially. but hopefully there is more information out there now about what depression is and how it can be treated. And, you know, getting back to the general issue of how do you bring it up, how do you tell people, I think it's, I hear it a lot. That's one of the most common things that I hear is that no one understands what I'm going through, and it's true. You know, people don't understand the pervasiveness and the all-encompassing of what you go through, and so I think it depends on the person that you are working with and dealing with, whether or not you feel comfortable sharing with them what you're going through and educating them. If you're at that place to be able to do so, then that's what I would encourage, because you know, a lot of times it's coming from a place of not knowing and not understanding, and so, you know, educating other people when you feel comfortable, because not everybody's going to react positively to that, and so then you're going to also have to deal with that reaction with people. So when to bring it up is a very individual thing, and I would, you know, work with that individual to see if they're ready for positive reaction and the not so positive reaction. Did you want to add anything?
Yeah, this actually may relate to a slide that's coming up, but I think this is a good time. And this applies mainly to more family and friends. And I think sometimes it's in addition to what Nancy, you said, and Dr. McKay, I think it's also important to at times keep in mind that the issues related to depression and spinal cord injury has also happened to our families and to the people who live with us. And maybe they just also don't know how to manage this. How do I handle this? How do I do this? So I think one thing that I often encourage the individual who's sustained the injury is to sort of at times think about what it might be like for the family. What might they be thinking? Because it has impacted them as well. And I think sometimes if we can see that this impact is not only about the individual with the injury, but it's also about the family, the caregiver, the friends. And that might then give you an opportunity to say, this has also impacted you. So I think that's a key thing. And the second part is also a sort of a bit of a personal story where my brother-in-law was also someone who lived with a spinal cord injury. And I remember him saying that he often would encourage people to just ask me. And when he would notice that people were watching or uncomfortable, he took it upon himself to say, if you have something you want to ask me. And I admired that, and I think that that's really a key issue as well, is allowing people to ask the questions. Inviting people to ask the questions, I think, is also a very key thing. So those were the two that I wanted to add to this statement.
So the next section is supporting a loved one experiencing a mental health crisis.
Yeah, I think this is a question, I think, back to everybody else in regards to finding the support of someone that's going through a mental health crisis within a spinal cord injury, because I'm going through that at certain periods of times in my life. But one thing that this is just something that I overseen during my times of dealing with all this health issue environment that I've been in is, in my perspective, there's like 4 types of people within disabilities in terms of their environment. So there's a person that has a disability with the support of their loved ones. So, their loved ones come and are within their care during the times of either in the hospital or at their rehabilitation or at that period of time. And so there is like a shoulder to fall onto or something like that within that period of that uncertainty period of time. But there's also people that have disability without any support of their loved ones, so they're pretty much on their own. And yes, there are support of people within the environment, yes, the PTs, the OTs, the social workers, but they only have a certain period of time that they can give their support. And then after that, they're back on their own again. And they're back on questioning, like, what am I going to do next? Or, you know, when you get a notice that you're going to get discharged next 3 weeks. So what am I going to do the next 3 weeks of my time of waiting till I get approved to get discharged? That's, you know, these are all questions that will affect your mental state of thinking. There's also other people with disabilities that have found ways to overcome their challenges, or they, you know, they look at opportunities and adapt with the circumstances that they're dealing with. That takes time, but they've put their own initiative to find that ways. But also there's other people that have disabilities that are maybe unfortunate, that can't handle that pressure, and they spiral down to whatever level of situation of unfortunate circumstances. So I think these are all questions that we all that are in these situations go through. But I think one thing that I found within myself is that I will share to everyone is I find ways that work for me at my own pace and at my own time. That's the only one way I could say, because everybody is different and I can't talk with everybody else's condition, their physical being, of how they can deal with the circumstances, their mental state of mind, of how they will overcome the situations. You know, I can just find ways that will work for me. I can give options of opportunities and possibilities that are out there, things that I find that will fulfill my enjoyment of my time, that I use in a productive manner. But I think that's an individual journey to go through to find that pathway of resistance. So that's what I wanted to share with everyone. Thank you.
Again, thank you, Brandon. I think that was very eloquently put. It is an individual thing, and respecting that in other people is very important. So thank you for highlighting that. I think it's a very crucial point for everyone to keep in mind. So I'm going to talk more in generalities, just in general how we can support each other. So one of the things, going back to what I said before, I hear it very often, no one understands or no one can appreciate what I go through. And so simple validation of what people are feeling and what they are experiencing is very powerful and can be very helpful for individuals when they're, you know, in that state where they're frustrated, overwhelmed, all that sort of stuff. Just recognizing that can be very helpful for some people. You know, just saying, yes, this is hard, this is scary. The other point I want to make is listening with care without trying to fix things for other people. That sometimes is not the most helpful thing, depending on where the individual is at that point. And I see a lot of nodding. Yeah. You know, listening and not telling people, don't worry about it. That's you know, that can be very dismissive to some people. And so again, those two kind of go together, you know, validating what the person is going through and then listening with care. And I'm going to turn the last point over to Bridget.
Actually, I just wanted to add another sort of piece that reflects what Brandon was talking about. I think when people are in rehab, their needs change according to where they might be. So their needs at acute care, you know, so the family comes in and, you know, they're by the bedside, they're providing a lot of support, very well needed support and very appropriate. And then the individual moves from acute care to a rehab hospital. And sometimes families have difficulty transitioning from doing everything to doing a little less. And I think part of it is providing also support to individuals and families that the needs along this continuum change as you become yourself and more independent and you learn about your strengths and so on. So I think that that's important to keep in mind, because certainly what you're feeling, what the issues are, will vary, will change from acute to inpatient and then to the community. So I think I just wanted sort of to add that, because I think you were speaking sort of in terms of that as well, Brandon. As well as, you know, asking, when I think of this last point, ask what they might need or want. I think that's not only for the individual. What are your needs? What is it that you want? What are your goals? You know, what activities you want to engage in. But it's also asking your caregiver, your friends, your support people, what do they need? What do they want? Do they need more information? Do they need education? Do they need a support group? Because these are the people in the long term that will be there for you. So I think that those are important questions to ask everyone.
I'd like to, Chantal?
Yeah. There you go.
One more thing that I do notice, and just Bridget, you reminded me of that, you know, that things change and needs change from acute to rehab to community. And I think a way to support a loved one is noticing where they've come from. So sometimes my clients don't, you know, they think that they haven't moved forward. So for a loved one to say, hey, remember last year you were here and this year you're here, just to kind of, you know, bring their awareness to the growth and how they've moved forward in their journey as well. Yeah, that's it.
Okay, so I'm going to briefly talk about what to do in a crisis situation, or just in general what can be done. So as Nancy highlighted in speaking about her story, is that, you know, prevention is probably the goal, but if, you know, that doesn't occur, how to help in situations where an individual is in crisis. So that might be when an individual expresses a desire to harm themselves, or if you are concerned for someone's safety. One of the things you can always do is bring that individual to an emergency department for an assessment. There are a number of crisis lines. The one on the slide is just an example. There's also mobile crisis units that individuals can St. Mike's?
St. Mike's has one.
Yeah. St. Mike's has one. But in general, if you're with an individual and they're at imminent risk of harming themselves, or you're concerned for their safety, you can always present to any emergency department. So that's always an option for individuals. Okay. The other thing, and maybe not in the immediate crisis, but if you want to help somebody who is, you know, experiencing mental health difficulties, one way you can help is assist in getting information. It can be a difficult system to navigate, as some of you do know, and one of the things is people don't know where to start. You know, a loved one could help provide some information, gather information about where to go, which programs serve which types of issues. Is there a referral process? Is there a wait list? That type of thing. So that's how family members can help, as well as just providing information and gathering information. Is there anything else?
Okay, so just want to share a little bit about my personal experience. So when I was injured for the first 4 years post-injury, my mom is somebody who doesn't talk very much, but she takes care of me. She would just try to cook what I like to eat, and just show me her support. And whereas my dad, he is a very verbal person. He will always be there, listen to me, and talk me out of my momentary, I guess, suicidal ideologies. And also I have a strong church community. I have a family of church members that we meet once every week just to talk about everything. And also I have a fabulous dog, and he is just so important to me. So I think getting a dog is very therapeutic for me. He's not a therapy dog, but he is still nice to have, better than a cat, I think, in my opinion. Yeah. Okay. Anyway, so just a couple of things that is really helping. I remember in 2006, my depression was so bad that I was thinking about giving up again. But what really prevented me this time was really just reflecting on the sacrifices that my parents had made over the years, and just thinking about how much hardships that they had endured. So seeing their face was enough to kind of keep myself from harming myself. I think family are just really important, and I understand that there are people that might not have such a strong support system, but we hope that you would be as involved with the community as possible. Here in Spinal Cord Injury Ontario, we have the peer support program and peer connection. Don't be afraid to reach out. Don't think that it's shameful. Don't be embarrassed, and especially for the men that they might not be as willing to disclose their vulnerable spots in their heart. Anyway, so really encourage you to reach out. Another thing I want to really highlight is going to an emergency psychiatric facility when it's needed. I felt like there's a lot of misconceptions and stigmas about going to a psychiatric facility, and misconceptions thinking that it's a terrible place, that people are crazy there. But in reality, it's really not that bad, and it's actually an environment that you can concentrate it on getting better, and seeing therapy almost every day, seeing your doctor every day, and there's therapy sessions, there's a lot of wonderful activities to help you get better, and it's very beneficial. So if it's needed, don't be afraid to go to a psychiatric facility. And also for family members, if you actually see someone already displaying harmful behaviors towards themselves, it usually means that their inner state is probably 10 times darker, because so you really have to take those signs and know when to act and really take it seriously. So all right, okay, so the next one is giving yourself a mental health checkup. I mean, at this time, I feel like if I'm depressed already, I know I'm depressed. I don't have to go through a checklist. I usually monitor my mental health by monitoring my sleep. Do I get enough sleep? Is my thoughts racing? Am I in a peaceful mentality? Am I eating right? So if I'm physically suffering, if I'm not able to function on a daily basis to do basic things, that means maybe I'm not mentally healthy, and maybe I should do things to change things up a little bit. So in my case, to improve my mental health, I would, as we talked about before, to eat right. I think that's very important, and then do exercise, regular amount of exercise, because a mental illness is an illness with our brain. It's a medical condition, basically the same nature as other illness with other organs in our body. So you have to think about how to improve your overall physical health, because once you have that right, and your mental health will just improve automatically. You might not even aware of. And also the importance about staying away from alcohols and smokes and recreational drugs. Many people use that as a coping mechanisms, but in many cases they are worsening your condition. They are really something that you have to avoid. And also recreational drugs can also trigger mental health, mental illness. So really be careful with things like that, and the choices you make in your life.
One thing though I just want to mention in terms of activity-wise, that is in my I'll put it in my own kind of words, is like, if you can find anything that makes you feel good in a positive way, No, that's therapeutic. You know, any kind of activity, you know, as again, like that will keep you physically active, mentally and physically, is good for yourself in your well-being. But also don't also push yourself too hard, because rest is also good too. So you need to balance yourself between you know, like pushing yourself and being active, but also there's also time that your mind, body, and soul also needs that also rest too. So that's also good. So balance yourself is one of the keys to sustain yourself in a good, healthy, well-being manner.
So I just want to agree with everything that you both just said. I think those are great points. And Nancy, to speak to what you were saying before about pets, I agree. Yeah. Pets, very therapeutic, very helpful. I'm also a dog person, sorry. And the other thing I think that an important point that you raised was the scariness that sometimes people can see with psychiatric facilities, and I work at one as well, and they're not that scary, and they do provide necessary treatment and a well-rounded treatment, as you highlighted. So a lot of access to care that is needed at that time, and so reaching out to those types of programs is very important in you know, in treating mood disorders. I also wanted to say, talking about mood disorders and depression and bipolar, you're right, it affects many, many different things that maybe people don't understand. There's a physical component, there's a cognitive component, there's of course an emotional component, and it impacts, you know, your daily functioning in terms of sleep and what you eat. So mood disorders do, part of the symptomatology of them is, you know, dysfunction in appetite and in sleep. So all of those things that you both spoke about, you know, making sure that you're taking good care of yourself are very crucial, with recognizing your limits and energy conservation and things like that. So not pushing yourself too. It's a balance, right? So I think those are excellent points. Am I going to talk about ways to monitor mood? Sure.
You can
Okay.
start.
So there's a number of ways to monitor your mood and how you're doing overall, and there's a number of different, I'm sure there's lots of apps out there. We tend to use mood charts and SUDS or subjective units of distress to monitor how you're doing on a day-to-day basis. And you know, if that is something, it's important to monitor it, and there's different ways that you can do that. So you can, like I said, through apps, through charts, through smartphones everybody has these days. There's a number of, but it's very important to do that, and to recognize how you're doing on a day-to-day basis, but also if it becomes a more persistent issue rather than an everyday up and down, that's an important thing to recognize.
So what I'd like to add is sometimes we can't see when we're spiraling. And so I think part of the sort of relapse prevention or the plan is informing our support network. Who are our friends? You sound like you have a great relationship with your dad, and they're probably aware of the signs. But having sort of speaking candidly to the people in your life and saying, you know, I may start doing this and I may not even be aware that I'm doing this. This is what I would ask your support in. So I think part of that prevention is knowing what works, and you've outlined that quite beautifully, as well as letting others know. So that when they start to, you know, Nancy suddenly is not showing up to the group in the community, they're going to say, this isn't Nancy, and she didn't call, right? So letting people know, if this starts to happen, reach out. And that will encourage communication, it will encourage support. So I think that's an important aspect of prevention, being aware, is informing others what the plan is. Well, actually, I mean, in looking at sort of when to seek for help, I think we've kind of really already talked about it. You know, when the symptoms persist, the ups and downs, when there are more downs than ups, and you start, you know, it interferes with the things that you enjoy doing. When suddenly you just don't want to get out of bed, and you know that this isn't you. When you've informed the people around you, look, if this starts to happen, let me know. I may need some support in getting help. So certainly just being aware of what changes, you know, Martha mentioned a few seconds ago, in terms of mental health, it's a cognitive, it's a physical, it's a behavioral thing. What are the things that you're doing that is not within your character, that sort of may indicate to others, okay, things maybe aren't going so well. So what are the behaviors? Being aware of those things. And again, informing the people around you, setting in a plan. What's the plan? I don't know if anyone else wants to add.
Yeah, just as piggyback again on Bridget's point there, a lot of my I have a client that finds it very useful to put visual cues up of, you know, what to do when they're feeling really, when their mood is really down. So maybe he actually listens to Janis Joplin, and you know, they're finding, you know, or going for a walk. So it's, you know, having those visual reminders, I find really helpful as well.
Well, one thing I just wanted to point out in my experience is there's a bit of a difference between when you're in a hospital environment and you're in a rehabilitation environment. And in a hospital environment, it's very it's a crisis, urgent situation matter, so it's very in that high pace of stress level. But in a rehabilitation environment, in my understanding, you're supposed to build yourself back up, so it's supposed to be in a way of a stress-free environment. So that's where, in terms of how when I was here in the center, a lot of times I go out to nature whenever I can, because I'm surrounded by nature. And I think and that's the opportunity I think people should take, should utilize the opportunity in this way to take. It is a time to reflect on yourself. It's a moment, time in your life to seek within who you are, because you will be spending a lot of times on your own in certain matters of trying to make decisions that, if nobody else is around there, you know, your family members and stuff like that, it's not every single time you're going to call on the phone and say, what am I supposed to do in this matter? You got to make your own decisions. And but as again, the opportunity is right there. You're in an environment that, you know, yes, you will have to deal with certain matters of, you know, going to your OTs, going to your appointments, doing a bit of some organizing and management skills of your time. However, if you can at least organize that, then utilize the opportunity to enjoy whatever is available. And you know, I think in that, one thing is you should be grateful of. And you know, I have to say I was grateful with, you know, the opportunity that I was given, and obviously I had to go through my own transitions, stuff like that, after discharge, and go back into society. But you know, you have to look at the good things, and at times it's not always the bad.
So I just want to talk about getting a therapy dog. I have a couple of friends that have got a free dog from the Lions Foundation, and this dog can absolutely do a lot of things for him, such as picking up stuff from the floor. And he even opened all the doors for him, and even does his laundry. So it's quite amazing, and it really helping improve his mental health by getting him out of the door. So he has to walk this dog every day, and also go to a dog park to visit other dog owners. So it was really fundamental to his emotional recovery. So if you really want to learn more about getting a therapy dog, you're welcome to contact me or contact the organization. I can provide you with more information. Thank you.
So I think we just wanted to have this final slide just to kind of bring things together of a lot of things we've already been talking about. So recognizing that adjustment is a process. People will go through this process at their own pace and in their own way, and it's important to respect that. Just remembering that it's ups and downs are going to be part of this process, and that's to be expected, and when to know when the ups and downs become more persistent, more interfering, that it is time to reach out and to seek some help. And I just wanted to add, one of the things we talked about in the previous slide that we didn't get to was the fact that one way to reach out, given the way our system is set up, is really through your family doctor, and that can be the starting point for a lot of access to mental health services. So that's just something to keep in mind, that you may have to go through your family doctor to access these other services.
I just sort of want to go on the point that Nancy just made, as well as the point earlier made by Brandon about quality of life. Number one, things that happened that were a passion for you before don't have to be forgotten. So if you like music, those will all add to the quality of your life. Pets, I'm a cat person, but I love dogs. I know, I had to say. But I think you're absolutely right. I think pets provide opportunities for socializing, and they're great in terms of reducing stress, giving you a purpose, and improving your own quality of life. So those two things I think are really key in this process. So I just wanted to add that as well.
Well, we have a couple of minutes if there are any questions.
I think it was more of a comment, just even from the first part, about it really rang true for me that, you know, people are going through so much, and whether it's due to something previous or the sustained spinal cord injury, and just all the decisions and things that have to happen with shorter stay times and that kind of thing, is really trying to keep in mind, you know, the brain and someone's limbic system. And so for me, it was just another way of thinking about it, and to really put focus on the importance of mental health, and are we really looking holistically at the person, and, you know, to really push for those services and that approach, and then into the community, because I think that's really lacking as well. Affordable assistance that doesn't take years to access. So it's more of a comment than a question, but thank you for all of your expertise.
I mean, this is more of wishful thinking. What has happened is, when a person goes through a spinal cord injury, what is happening around them too, within their family, they could be fluctuating between anger and acceptance and denial. And then the thing is, the person who goes and sees someone who's a mental health professional, goes and meets with peers, may sometimes arrive at acceptance a lot earlier than the rest of the family does. So sometimes you need to have some coping skills as to how to bring your family members and bring your support to acceptance, and I think that happens at different paces with everyone. So it's wishful thinking. I wish like family members had access to support as well for mental health.
You just mentioned, I'm sorry, I don't remember your name. Yeah, Meredith. When you talked about how in the recovery, it's not only the brain, the mental health, there's just so many factors in someone's recovery. And I think from an inpatient perspective, the importance of utilizing the team, the whole team, and everybody's, and then part of that team is family. Because I know when I'm working out at the outpatient program with some of the folks there, I always say to them, when you leave here, who's going to be with you? And so everything we do, inpatient or outpatient, is this is your rehab team. How are we going to prepare you? What's the skills that you're going to need? Because when you leave this facility, you're not taking us with you. You know, and keeping in mind that you need an entire team to work, and part of that team is yourself and your family, or whoever you identify as the important person in your life. And that makes part of the team, and I think that that starts at inpatient. I think it's a really key part of that recovery, and then family. Yeah. Sorry.
I just wanted to add quickly, I do, it's a very important point, especially the point you made about if the individual is at a different spot than where the family is, and that can cause some, I can imagine, can cause some disagreement or some difficulties within the family. And so one of the ways that we attempt to address that, and you're right, there's more resources needed, is through, patient and family education sessions that are offered either at Lyndhurst and through other venues as well, to encourage patients to bring their families to those things and so that they have more education as to what spinal cord injury is all about and the number of things that it can impact. In terms of psychological support, it's resources, obviously, but also, if somebody is an inpatient, we do offer that if they are struggling with their family members to help to educate, to provide, say, psychoeducation about stress, coping strategies, and things like that. So we do try to do that whenever possible, but I agree with you. I think more of that needs to happen. Yeah, great point. Great point. Anyone else?
I really want to thank the panel today for sharing your perspectives and your experience on such an important topic that is hard to talk about. So Nancy, Brandon, Chantel, Dr. McKay, and Bridget, thank you very much. I know this is going to be a tremendous resource for our community. I want to thank Rodney and Christine for hosting our online piece of this. And what to say? I mean, it's hard, but it's great to talk about it. And it was really good to hear people talking about it so openly today. And I learned some new things, so I really want to thank you for that. And thank you to the participants as well, and we'll wrap it up here.